Good morning or good afternoon. Thank you for joining us today for our Research in Progress webinar series. My name is Carrington Lott and I'm the Program Manager at Systems for Action. And we host this bi-weekly Research in Progress webinar series to allow our grantees to provide updates on their research projects as they move throughout their grant life cycle. And this is going to be our team at Texas A&M's, I believe, third Research in Progress webinar that they'll be hosting today. So we'll get some good updates from them. And they will be presenting on their project, which is titled Addressing the Health and Social Needs of Justice-Involved Young Adults. So we're sitting through the welcome right now, and then I will hand over the reins to George and Terrence so they can give us an update on their project. And then we'll hold some time at the end of today's session for questions and answers. So if any questions come up along the way, please be sure to click on your Q&A button that should be at the bottom of your Zoom screen and enter your question in there, and we'll make sure that we address those at the very end of today's session. And with that, I'll give a little introduction for each one of our presenters. So we have George, who has his PhD and Associate Research Scientist and at the Public Policy Research Institute at Texas A&M University, and he's a research fellow at the IZA Institute of Labor Economics. And then we will be hearing from Terrence Davis, who will provide commentary after George provides an update on the project. And Terrence is the program director for the Transformative Justice program of Williamson County. So they'll both have some very wonderful things to share with us. And with that, I'm going to stop sharing my screen. And George, if you want to share yours, that way you can control the slides. Perfect.
All right, so good morning or good afternoon, and thank you for the opportunity to present an update for our work. Before we go through those updates, I just want to kind of, provide a context of, who the research team is, and can I give a context of what the project is all about. So this is an ongoing and a joint work between the Public Policy Research Institute at Texas A&M University and Access to Justice Lab at Harvard Law School and University of Texas Health Science Center. And we were working with Williamson County in Texas, and the program team is made up of Judge Stacy Matthews, District Attorney Sean Dick, and Program Director Terrence Davis, who you will hear from later today. With that said, to give a context and try to kind of bring the motivation to the table. So criminal justice is failing emerging adults, those who are between 17 and 24. They make up about 10–12% of the Texas population, but they account for almost a third of arrests. And the reason for this high recidivism rates is the underlying factors, the health needs, are not being addressed. So we're looking at substance abuse, we're looking at co-occurring disorders, we're looking at emotional and physical trauma. As long as those factors are not being addressed, you keep expecting recidivism and new criminal activity to be high. So with that said, a criminal justice system is struggling to deal with those high recidivism rates. Now, with that said, the research project relies on two main questions. Does a community-based service program, improve emerging adults' physical and mental health and reduce recidivism? Obviously, compared to the current, criminal justice system, and we do that through a randomized control trial that we'll, discuss in details in a few minutes. And the other part of the study is to address, the process and to do an evaluation of the process. What features of the program are driving these outcomes? What are some of the challenges and successes? With that said, I want to just give you a quick, brief, idea about what the TJ program is all about. Whenever somebody gets arrested, and we're looking at felony arrest, a needs assessment is done to determine the factors that are contributing or contributed to that criminal behavior. A review team review those assessments and proposes basically services to best address those factors. And this review team will create the individual care plan for each defendant, and then the defendant will go through that plan, and the team will liaise with the criminal justice stakeholders and keep them updated with the performance of the defendant. And there are 3 phases for the program. Now, for the study flow, in terms of the randomized control trial, we're looking at arrest. We look at eligibility. I'll talk about eligibility in a second. We do, consent, randomization. Those in the treatment will go through the TJ program and go through those 3 phases. And those who are in the control will go through the current criminal justice system. And then we look at a few outcomes to compare between the treatment and the control group. Now, I mentioned eligibility, and eligibility for the study is, for those who have been arrested on a felony arrest between 17 and 24. This arrest has to be an eligible offense, meaning certain offenses are not eligible. Those include, violent offenses, assault, and any offense related, with children, and so on and so forth. Mainly, most of the eligible offenses kind of hover around drug offenses, so felony drug offenses. You have to be between 17 and 24. When we looked at this, we expected about 12 enrollees per month, so about 144 participants when we did the sample power analysis, and I have those in italic just because I want to come back to that in a second. Now, the outcomes of interest that we're looking at, mainly recidivism, criminal justice outcome, but also health outcomes. The recidivism comes from criminal justice data, and health outcomes comes from quarterly surveys that we are conducting using the SF-12. We're also in the process of collecting other outcomes from agencies that have admin data, such as education, attainment, housing, employment, and so on and so forth. Okay, with that said, the update for us is we launched on November 2nd, 2020, after the delay that obviously partly was due to the pandemic, but also partly was due to shift in program leadership. The enrollment we have so far, after almost 10 to 11 months of enrollment, we have 27 participants, 12 in the treatment and 15 in the control. And obviously that's a lot less than we expected. We were expecting, as I mentioned earlier, about 10 to 12 a month. We are averaging around 2.4 participants a month. So we spent time examining the reasons behind those low enrollment. And it looks like we are zooming into less booking in general. So less defendants are being arrested. How much less? A lot less, actually. Those 2 tables kind of summarize number of bookings and defendants at Williamson County who were arrested in almost 4 consecutive years, from 2018 to 2019 and 2020, full years, and 2021 up until August 15. And you can see the bookings have hovered around 12,000 a year for the 18 and 19, but dropped by almost 50% to 6,000 and 7,000 in 2020. 2020 obviously was an odd year, and we looked at beyond 2020. We looked at 2021. The data that we have goes all the way until August 15. Even with that, and the table to the right limits the data to August 18, you can still see a drop into 2021. So that could be the effect of the pandemic is still lingering, but that also could be other reasons. Now, if you look at the sample that is eligible for our study, so those who are between 17 and 24 with eligible offenses, we're looking at a drop of more than 70%, which is obviously concerning for the power of the study. With that said, we also looked at whether that drop, how it changes over time, and again, we're graphing here a number of unique bookings monthly, and you could see the drop for 2020 and 2021, and looks like more of a pragmatic drop rather than just a unique, a pandemic-related drop where it drops around March to the summer and then goes up. It actually looks like it's more a stable drop than anything else. So what are some of the reasons? I mean, some of the research we've done, some of the conversations we've had relate us or push us to think about there are pandemic-related reasons. There were less people out and about during the pandemic at different times during the year. There were less police out and about, just as less people out and about, which means less likelihood of having crimes and recording crimes. And there were also unofficial rules and policies to keep jail population low during the pandemic. Delay serving warrants, for example, not arresting for low offenses. For instance, if you don't arrest somebody for a small offense, you may not impound the car, you may not search the car, you may not find the clothing or the body, you may not find drugs, and you won't end up with a drug felony. So those were specific reasons for the pandemic, but there were also other reasons that were more of things related to the justice system specifically, and perhaps the pandemic actually did push this direction further away, or other events. But we're seeing decarceration movements, decriminalization of small drug offenses, changing arrest patterns altogether. So some of those reasons and low enrollment pushed us to have an open discussion with Williamson County and those involved with the program. And we actually had multiple conversations over the last year. And the last one we had was on October 1st, about 2 weeks ago, to consider adjusting eligibility criteria to expand enrollment. And that's something I'll come back and touch on at the end of the presentation. The RCT is set up, there were lots of effort and, resources put in to push this forward. At the same time, you want to make sure that you keep the fidelity of the project and the program, and you do not expand in a way that just to increase enrollment, and you move away from what the TJ program is all about. Now, with that said, the struggles in the enrollment made the process eval very important. I mean, it's already an important component of the study, but this emphasized this process eval further and made us, examine, some of the interviews that we've done in more in depth. So, in the process eval, we were looking at, what factors are most associated with the outcomes, how the system and the program changed over time. To do so, we have been, meeting on a weekly basis with the program director and others, doing interviews, focus groups. We did direct observations of, court, and the next step also to do a document review and document analysis. Things that we want to try to address are, what are some of the most effective elements of the program? What are some of the challenges facing the program? How do participants feel about the program? How is, the local community interact with the program? How did the program kind of evolve over time? And obviously, some of those questions we could shed some light on today. And some of these we'll have to come back to at a later stage once we do another follow-up, a round of interviews. With that said, what we have done is complete phase 1 of data collection. We have interviewed 14 stakeholders directly related with the program. The program director, Terence, is going to have some comments today. 3 case managers, 2 program lawyers, 2 judges, a district attorney, and 2 county staff. And then we also had the interviews with service providers. We also met with the participants, 12 participants in a focus group, 10 active in the program, and 2 who've already graduated. So they were considered alumni. We did attend a pre-court planning meeting with the judge and a program director, case managers, and the district attorney. And we did attend a course session and a life skill course later that day. The second phase of the data collection is planned for the spring, and we're going to basically redo the same list of interviews. And we will also perform a document review in the meantime. All right, so the program evaluation that I want to kind of present to you today is centered around four main components. The first one is what's working. This is going to come from the program team. The second component is the challenges. That's going to also come from the program team, from the discussions we had with them. And the third component will be the participants' perception. This is going to come from the participants themselves, those who are in the program or those who graduated. And the fourth one, we're going to look at the impact. And the impact is going to be divided into individual impact, the impact on each participant, and we're going to look at the community impact. With that said, let's start with the first component, which is what's working. And some of the so I have a lot of quotes on the screen, and some of them are lengthy, and we have a lot more quotes, but I'm not going to go through these, but they are there for you to kind of look at, and I may touch on a few here and there. But some of the things that we asked the program director and case managers and those who are involved, what are some of the services that are most effective for the participants? And we kept getting almost consistent responses from those interviews. The drug treatment were very effective. Case management were very effective. Counseling and life skills was also very effective, in the sense that the case managers felt having weekly drug testing, sending participants to drug treatment to address issues related to drugs and alcohol, case management, making sure that they are always on top of what the participants are doing. Counseling and life skills seem to be really, really effective in helping participants go through that period. Then we next asked the question about, okay, so if the services, those four that we identified, seems to be really helpful, what about relationship with the participants? I mean, you're thinking about services that are being effective, but what about your relationship with the participants? And this is something interesting because we asked the same question for everyone involved in the program, and everyone mentioned how relationship building with the participants is very, very, very important, as important as services. The judge, for example, inquires about the lives of the participants, what they have been up to, how is work, what are things going on with their life. During court, the judge, the lawyers, everyone who's there cheers for each other, cheers for the successes of the participants as they go through the program. The judge also encourages peer support. Case managers are there for the participants literally at all times during the week. And we saw that everyone participates in program events. The team acts as case managers all throughout, meaning the participants, they don't have to really just go to the case manager. They can go to the program director, they can go to the attorney and ask questions and get that help. With that said, something that all program, TJ program stakeholders kept reiterating was that, yes, we are building a strong relationship. We're working towards earning the participants' trust, especially at the beginning where trust is obviously an issue. But at the same time, we want to make sure that to hold participants accountable, that at the end of the day, this is a felony arrest, this is a felony offense, and jail is potentially on the table if the participant does fail in the program or does drop out of the program. So you build a strong relationship and connection, but at the same time, keep that accountability very clear among participants. Okay. Now, something else that we noticed besides the services, the relationships, and accountability, that what's working is really the strong team that the TJ program has. And this is something that it comes at us very clearly when we interviewed everyone who is basically involved in the program. So we're looking at people who are dedicated to the program, people who are providing one-on-one attention for each participant, people who are invested in the mission and who are putting themselves available to those participants at literally all times, as I said, during the week. And this did not seem to be something that came out of coincidence. When we talked to the leadership of the program, they mentioned that they handpicked those members to be part of the program. They were looking for dedication, and they were looking for desire to help and experience helping youth in this basically area. Now, with that said, the next thing I want to mention is when we talk about services and relationships, something that the research team kind of focused on is which one is more important, are the services or relationships? So we asked the program, leadership about this, and interestingly, again, the message was very consistent. They go together. They're complements and they're not substitutes. You have to have services because participants have needs that need to be addressed, but at the same time, you want to build that trust and you want to build the relationship with the participants so they can actually do well in the program and persevere and open up and create this family-like atmosphere. So the program really cannot go without either one of them, and this is something that all program stakeholders reiterated again and again, and something that we took note of. Now, this gets us to the second component. So we talked about the first component, which was what's working. The second component is what's not working, in the sense that some of the challenges that the program faced. Things that the program leadership actually kept coming back to is that they're struggling with transportation to court, transportation to life skills, activities and other events for the participants. Another thing that they have challenges with is housing. Some of those participants do not have the best relationship with their families, and they have a strong conflict. So they are on their own. And with a felony arrest and a felony offense, it's not straightforward to be able to get an apartment on their own. So housing is a big challenge. Counseling also turned out to be a challenge. The provider, for example, in Williamson County had a counselor who moved away. So there was some concern about doing that the counselor did provide counseling online, but some of the participants did not think that was very effective. But the program did actually adjust to this and went out to the community and was able to get counselors who were in the community who would volunteer to provide this counseling. So you can see some of the challenges, but you could also see some of the response from the program. Another, for instance, challenge was a financial literacy course online that the participants had to go through. That did not go well at all. The participants did not think that was helpful or informative at all. So that was actually let go. Another challenge is getting this, match. And as I mentioned, the financial literacy course. You want to make sure, you want to avoid over programming, over courting, making sure that you address the needs of the participants with the right services. Not just the right services, but also timely services, right? So, being able to establish what services and the needs needed, and then being able to effectively get those services, there might be some delay, and that delay is concerning for the program and for the participants. So this matching process is important. You want to also make sure you do not make the participants overly reliant on the program and less independent. So that's a challenge that a lot of the program, leadership and stakeholders brought up when we talked to them. So something we touched on in the RCT is the low enrollment. So the case managers, and again, going back to the quality of the team, they are eager to serve as many participants as possible. So they feel that they would like to have more enrollment in the program. And obviously, as a research study and an RCT, that's our main concern also from the statistic side and the quantitative side. They feel that they have more resources and more time that they could expand in terms of allowing more participants to be part of the program so they can actually serve them. So, however, with that said, keep in mind, that we always, as a research team, wonder what would be the right amount of participants that the program could handle with some of the services and the one-on-one kind of attention that participants are getting. All right, so now we are done with what's working and the challenges from the program team. And again, I have a lot more quotes and things to share, but I want to just give you a brief summary. The next component, the third one, is participants' perception. So this came from a focus group and our communication and discussion with the participants themselves. The first thing they actually highlighted is that they felt that the team has been very supportive. The team of the program includes the case manager, the program director, the lawyers, even the district attorney and the judge have been very, very supportive. And one quote on the left really stood out to us in the sense that they said, most parole officers they feel that they want you to kind of fail, and that's how the participants believe. But they feel that this team really wants them to actually succeed, and they try to do everything possible to raise that confidence so that they can become independent and be able to be drug free and stay sober. They, for example, the one on the right, they say, I called my case manager at 2 a.m. and the case manager did respond and was able to help me in a moment of crisis. So they believe the team has been very, very supportive. All right, so the second thing that the participants did mention that they felt was a little bit too, well, maybe a little bit annoying, but they said they struggled to accommodate the requirements of the program. They thought the program was a little bit, it was rigorous in the sense that they were balancing the work schedules and program requirements, but they also had to meet with the case managers that afternoon or go to a life skills building activity. They did have mixed reactions to counseling, as I mentioned earlier. Counseling was happening online, so initially there was a struggle from the participants, but that evolved over time. That changed, and I think they had a better response after that. They felt some of the sessions and drug tests were a little bit excessive, although they were happy that they were doing them. Some of the things that they had to do, check in with their case manager every day, and it depends where you stand in the program, which phase you are. Those check-ins and court hearings, the frequency change, and so this is basically what the participants mentioned. The last thing that they mentioned is shifting perspectives. This is where you're thinking about, initially they were struggling to meet those requirements from the program. Check in on a daily basis, talking to your case manager, not ignoring a phone call or a text, making sure you show up to the life skills building activity. And so they were kind of overwhelmed, maybe even annoyed. But then as things progressed, as they saw themselves feeling better, so that these activities and program requirements were actually making them be on the right path, they were a lot more accepting. So at the end, they even felt that those services, those requirements address their needs, and they feel a lot better. When I mentioned life skills building activities, these include financial literacy advice, how to change a tire for a car, how to maybe make soap and package it and sell it, and things like that they could actually maybe eventually use it as skills for either a career or to make money or just as a hobby. Now, the last thing that I want to talk about is this impact. So the fourth component is the impact from the process eval discussions we had with the participants. How is the program making a difference? And I'm just going to focus on the first quote right on top. When we asked those questions to the participants, do you think the program made a difference? We got a very strong, resounding yes from everyone. And somebody jumped in and said, if it wasn't for the program, I'd probably be dead. And that participant mentioned how they were lost, they were going down a really bad path, and they feel much better now. They feel independent. They have their own place, and they would have been dead if they weren't for this intervention. So they are very, very grateful for the program. They feel that they are a completely different person, that the program gave them a new chance in life, and a future that they never thought they had after they got arrested for a felony. So that's a very, very powerful quote and a very powerful impact for the program. Now, when we asked, what about the community? So we know that the program is affecting the lives of the participants and making a difference. So we talked about community impact, and we asked this question for case managers and everyone in the program. And you know, something that came up to us and was very clear is that the program leadership interacts with businesses in the community. You know, they actually literally just cold call them. But as you know, information about the program and what, you know, some of the things that are being, you know, done at the, you know, helping the participants, some of those businesses are also reaching out to the program leadership and trying to help. But they can help with donations, but they can help also with giving internships and even jobs for participants. So they want to have, you know, contribute to the learning process and helping process for those participants. And they see that those participants are giving back to the community, and they're getting a lot more involved with internships and jobs and volunteer. So this is also a very powerful impact. Now, from a research perspective, given the low enrollment, you know, one would argue that, you know, you want to think about big picture and making a difference in criminal justice. Having a larger, perhaps, number of participants will make a difference in the community and the criminal justice. But that's something, you know, that's something to discuss at a later stage. All right, so the next steps for the process eval, and I'm almost done, I have another slide, is basically to you know, dig more into those findings. This was a very brief kind of summary of some of the things that we discussed with the program stakeholders, the participants, and everyone else we met, and the observations we had. You know, we want to try to kind of synthesize this into recommendations for the program and for the county and for everyone else who's interested perhaps in implementing a similar. And we're going to pursue a document, also review, extensive document review in the next few months. Something that I haven't mentioned earlier, and that's going to be my last slide, is that we also establishing an advisory board that basically will allow participants in the program to give feedback on the design, on the recruitment, on retention, on everything they want to talk about. And we're actively recruiting. I think we have already 2 who signed up, and we in the next few months we're going to have a few meetings with the board and discuss the program, discuss the study, discuss basically their experience, and document this. The last thing I want to mention before I give it to Terrence is, when we attended the court, we had it was very different, you know, kind of feeling. While there's that accountability that I mentioned, but the court felt a lot more like a supportive session, while at the same time making sure that the participants realize that this is a court hearing, this is gonna, you know, affect their case outcome and you know, their outcome in the program altogether. But everyone was cheering on everyone's success. The judge allowed, you know, participants to, you know, give supporting messages and talk to other participants about some of their struggles, and saying, hey, you know, you can make it. You know, we're proud of you. We believe in you. And so, allowing participants to take ownership of their own successes, but also help others and try to be basically a support system, not just from the program, but their participants. So thank you very much. I'm going to stop right here.
Terrence, do you want to add any commentary here about the importance of this project for the program, or do you want to move to the question and answer section?
Oh, I'm an attorney. I can't give up some time. So first and foremost, thank you for having me. I'm Terrence Davis, the program director here at the Williamson County Transformative Justice Program. It is such a wonderful a breath of fresh air. Basically, we know what the criminal justice is designed to do. It does it regardless of who's in the wheels of justice. And I think that overall, Williamson County, I was surprised and pleasantly surprised that Williamson County, which is historically known as a extremely tough on crime. I mean, we're neighboring Austin, which is Travis County. And historically, people would say, you know, whatever you're doing, like, you better stop in Round Rock, like right between Travis County and Williamson County. Don't commit any crimes in Williamson County because you're going to go to prison for life, basically, for everything, speeding ticket or not. And so it's somewhat true in that there's a pretty, conservative view about it. And so I was pleasantly surprised that Williamson County, the county commissioners, worked with the research team, the Texas Indigent Defense Council project, to get this started, to think of how can we, instead of just being tough on crime, more importantly, can we be smart about crime? Looking at why do these particular individuals have these issues, and is there something we can do that's different? We know how to do jail. We're very good at jail. We know how to do that. We know how to throw the book at people, a brick at people, and they get up and they're bruised and they're no better off, and then they go off and do it again. We haven't addressed. It's kind of like going to the doctor and you tell them, hey, I have this problem, and I remember this has actually happened to me. I tore all the ligaments in my ankle, and I went to the doctor. It was a minor emergency, and I said, it really hurts when I walk when I touch this foot on the ground. And that doctor told me, and I'll remember to this day, well, don't use that foot. And so it's not really helping you. It's not really addressing the pain or the concerns. But so this program, as George has highlighted over and over again, is about relationships, trying to invest in these people that actually need these services. We haven't really talked about what are called ACE, adverse childhood experiences, and it's a scale 1 to 10, and most of our participants come from a troubled past, and those high ACE scores, most of ours are between 4 and 7, and those are extremely high. It only goes to 10, and that is usually a history of some sort of abuse, breakup in the family, people serving prison time. And so if you were to look at those individuals and say, okay, I think kind of like our family, if anybody here knows anyone that has children, or you have children yourself, if you were just going to stick them into a sterile environment and not help them at all, you would expect certain outcomes. If you, every time they do something bad, you just hit them with a stick, you're going to expect certain outcomes. And then there's people that will say, hey, let me help you. What's going on? How can I better assist you? And why are you lashing out? And they may be lashing out because maybe they can't read and they're frustrated. It may be lashing out because their parent abused them. Whatever it is, I think that looking at justice is more than the criminal justice. I think we need to look at personal human justice and looking at how do people form who they are? Why do they make decisions they make? And some of it is based on illness. And so, yes, there's comments on here. It may not be, maybe a single mom or father not involved, or vice versa. Sometimes they're overly involved. We've got situations where the family's the problem. So it's not just, do they have the family? It's what is their family and what is their history? Unfortunately, we don't get to treat the parents and some of the family members. And so sometimes we have to navigate, and I think George talked about that with the housing. So sometimes we're trying to navigate, it's like trying to treat this person for these number of hours, like going to school, right? If you have a child and you're teaching something at school and then you send them back to the same problem house and expect it to not have an impact. Well, it does. And so we really are so excited about what this research may actually reveal. And one of the questions, and we'll get to that, I guess I'll save it for the question and answer, but I saw one question that came through that talked about misdemeanors, and I think that's something I want to at least touch on now. And that is, I absolutely 100% agree that why are we waiting until they're a felony to address it? And the answer, I think, is twofold. One, we're just trying to figure this out, so we're early on. Number two, we have to figure out with felonies, there's this big stigma, as George talked about, with can you get housing? Can you get a job? There's a little less stigma with a misdemeanor, at least at this current point. And so some of our big carrot is an expungement if they complete the program. I don't know, because we haven't tried it, whether it would have as much buy-in from the participant, maybe because the carrot is smaller for them. Maybe they think they can beat a misdemeanor, or the misdemeanor is not going to affect them as much. I don't know, but I absolutely 100% agree therapeutically that addressing these situations when they're younger or smaller crimes is where we need to be. I think we need to figure out how to get there. I think we can. I think all the people that are brilliant in this room and that are watching, I think there's a lot of opportunity for us to think outside the box. Right now, we're trying to prove this concept of, if I care about people, if I invest in them, if I give them some more attention, if I actually address some of their concerns, not just send them to the principal's office, but have an accountability team instead, that we have better results. I think it's undeniable anecdotal evidence so far that is exactly what's happening. I think I'm creating some videos of all of our folks, and we're going to definitely do that. Someone's talking about being proactive with their mental health. Absolutely. I think that mental health is a big component of what we're doing. And George talked about some of the struggles that we have, and that some of that is structured by the grant nature. Sometimes in a grant, you have limitations on the money needs to be used for this or that. And so we've kind of had to pivot, and that's what you have to do when you're working with these types of situations. You have to pivot and try and figure out how to do it. So those are my general comments. Thank you for having us. If you have specific questions, I'm here to answer those as well. I really am excited to be here. So thank you so much.
Thank you, Terrence, for joining and providing commentary. And I am going to properly share my screen here. We've made it to the Q&A section. So if you have any questions, please feel free to enter them into the Q&A box, and we'll make sure that we address them. And George, I usually ask the presenting team what the next steps are in the project, but you were on the ball and you've already answered that. So I think I'm going to go ahead and move on to our first question that came in from Anonymous. Let's see. Are there ways for colleges or future employers to access the criminal record regardless of an expunged arrest record?
They're not supposed to. So if everyone does their job, and we have attorneys that are really trained on helping make sure the expungements are full and complete, there are some nuances to that. They're working on things like when their mug shots are out there, that's in the public domain. How do you get that undone? And so I think that is something that they're pretty good at. I think the answer is it's pretty good. Is it perfect? I would say nothing is perfect when you're talking about this, but I definitely think that's a great question. It's very important for them making a turn in their life, getting into, we've seen it at least with housing, for sure. It's made a difference in people being able to get housing. But I'm sure if you dig hard enough, you could find something. We have one of our participants who we didn't know, but she was working with Jail to Jobs, and she was doing such a great job that the newspaper came out and covered it. And so her name was in the newspaper. So we're trying to figure out how to deal with that. So it's kind of some of it's spilled milk. It depends on who knows it. But as far as being in the public domain or out there for someone to legitimately do a search for it, I think the expungement will cover most of that.
Thank you. And George, do you have anything to add to that? I feel like Terrence properly addressed.
No, I don't. Thank you, Terrence. And I was looking at the other questions. I think Terrence can also handle a couple of those, but let me know, okay, Terrence, if you need help.
I'm guessing, Terrence, this one is probably going to be geared towards you. It comes in from Ellen. Is there pushback from gangs or cartels, and how do participants handle this?
Are there pushbacks from?
From gangs or cartels?
Not yet. I don't know that we've had a few participants who have been, we would call heavy drug dealers, but no one has expressed any concerns about that yet. Now, we're not in, Dallas or San Antonio, like bigger cities probably would have a little bit more potential for that. And fortunately, and also the other thing that is a little bit unique for our program, and some of this may be strategic, I'm sure, on behalf of starting out a program as wonderful as this, is these are mostly nonviolent crimes. So we don't, if people have been involved in gangs, they may have multiple, previous felony for something that's more violent, where there's a burglary or an assault or something where that would eliminate them from our pool. So that may be part of the reason why. And hopefully we're preventing them from going down that path. I definitely feel like some of our participants were on paths where that was all they know. That's the only way they could make money. And that's the only thing that was their family to some degree is their gang friends, so to speak. I don't think we had any cartel level type affiliations just yet that I'm aware of.
Thank you. So we had a question that came into our chat a little while ago, and I wanted to make sure that we address this. And I don't know if George or Terrence is best suited to answer this, but John Kezer, I believe, asked, can you provide detail about the life skills component of the services in the program?
Absolutely. So the life skills component is something we meet every week. There'll be 3 case managers that are there. We meet at our office. I will attend some of those. I don't attend all of them for transparency, but I enjoy them when I do. I was here yesterday when we had it. Our attorneys will appear at some of those, and some of our vendors have presented at some of our life skills events. We recently went to HEB, bought a bunch of food, about $500 worth of food or so, and went to the Texas Baptist Children's Home, which is a home that they have multiple houses there for. It started off as kind of a fostering. It's been there for a long time. It was called Starry before, and they provided housing for single moms. Now they are working on with teenagers, and so anyway, they have a food pantry there where people that live there can come and get food and pick it up. And so I wanted our participants to go to HEB, find out how. I gave them a budget. We broke them up into teams, and we gave them a list of their approved things that they needed. And they got to see like how much stuff cost. And we told them about, when you go to HEB or whatever your grocery store is, on the little tags, it'll tell you like, how much per ounce or per serving. Like they play tricks with you on, the size of the packaging or how much diapers cost, or, different ideas. And so it was pretty interesting to see the 3 different teams show up with all the food. And then we went to the pantry, dropped it off. We had one of our participants who was not able to go on the HEB trip, and he used to actually be there as a foster kid, fostering families there, with his family years ago. And he went shopping on his own, bought $100 worth of groceries because he just got paid. We reimbursed him, but he showed up with his own cart of food to give to them. And we had another participant that day who he won a $50 gift card to HEB, which is a grocery store. And he donated it to the Texas Baptist Children's Home when he arrived. And he's someone that probably could benefit from that $50, but he gave that away. We help people with budgeting. We try and let them know how much it costs to go live on their own, because some of our participants, frankly, don't understand the value of where they are. We talked about how much you think it costs to live on your own. We talked about their earnings. Why is it important to get a GED or a high school education? Why is it important to look forward towards job skill training? Why is it important to stay sober so you can get a good job? They all want to live on their own. They all want to have a real life, right? But they don't understand how much it costs. And everything cost more if you don't do it. The other thing that our team really works with them on life skills, and so I would say life skills is probably 50% of the program, honestly. honestly. It's that regular weekly meeting where we get to have hands on them, talk to them, so to speak, and sit down with them, be real. We eat pizza or whatever we're going to eat that day. Mark, one of our leaders, he will talk with them about challenges they have with, losing their temper, how to deal with tough situations, how to deal with peer pressure, how to deal with all the kinds of life things that you kind of take for granted, opening a bank account. Anything that you could probably think of, that's what we do in life skills, but we do it in such a personal way that they all get to engage with one another. They were having a debate last time of how to deal with tough issues. They were talking about, I know this is strange, but they were talking about you had to argue pro-abortion or anti, pro-life or whatever, right? And so they had to, even if they had a position, they had to argue the opposite just to see how they could deal with it without getting hot-headed and how to deal with the tough situation, because there's a lot of stuff in the media right now. These are real life things that, and some of them, if you're not trained on how to calmly, and I know that may be hard, calmly respond to something and move on, I think it's a good practice. They listen to each other in these life skills meetings. We were asked them the other day in court, how many of them like Tuesday life skills? And I think every one of them raised their hand. They really look forward to it, even though, George talked about at the beginning about how they got to adjust their life and what days they can work and all that stuff. And they basically just we try and accommodate. So life skills is where we get to spend a lot of our loving on them time. We get to listen to them. We get to just see where they are in person. A lot of the other meetings are on the phone or text, or we're talking to them in other settings, or sometimes we go do stuff outside. But life skills is huge. Definitely most important component, and the case managers by far. I would get rid of me 3 times over to have more life skills meetings and more case managers to have more one-on-one time, or whatever.
Thanks, Terrence. That sounds really applicable and covers a wide range of services that you're kind of covering and learning about. And those are things that are often overlooked and people don't learn. So thank you for expanding on that. So you talked a little bit about housing in there. So I'm going to kind of segue into this question about housing that Christine asked, but she's curious if there are group homes for troubled teens.
There are. We haven't got into a full group home situation. The closest we have right now is a partnership we're working on with Texas Baptist Children's Home, and they have an application process for us to accommodate some of that. We have to have some sort of, they have requirements there. They want you to be either full-time in school, full-time working, or half and half. You also have to, they're going to have their threshold. They're kind of experiencing with having men there, young adult men, and they're just now branching off into that. And so we haven't had a lot of full-on group home experiences yet, but we have worked with them. And so that's really new and happening in the last probably 60 days. But we're excited about that opportunity. We really had like inpatient problems, right? Where do these people go? We had a couple that were homeless. And so we had to work around some of those maneuvers, but most of these places actually want you to be 18. So that's another challenge. I mean, I know our age group is 17 to 24, and most of our participants are 18 to 24. But we had a couple that came into the program that are at age 17, and we had to wait. We had one guy who had to wait in jail until his 18th birthday so we could send him to this place to get treatment. So there are definitely some hurdles there that need to be addressed. So great question.
Thank you, Terrence. So we're going to move on to the next question. I don't know who to address this to. I imagine both of you could speak to this, but could you talk about how you get the buy-in from all of your stakeholders in this project?
George, I'll let you take one. I feel like I've been talking too much.
I'll give it a shot, but you definitely want to also give the other side. So I think it goes back. I mean, I mentioned at the beginning or during the presentation how important the program team was, and how honestly sometimes we feel it was special and very dedicated. But it really goes back to also the leadership of the program. You look at the judge and you look at the district attorney who in one of their comments mentioned that, criminal justice, we've been doing the same thing again and again and again, and obviously it's not working, so we need to try something else. So that has to come from within the county, and not really from the research team. Now, the research team, from our side, we provide the best research design, the one that is doable, some of the answers those questions that the stakeholders of the county have, and we maintain a good working relationship with them throughout before the project, but also throughout the projects and beyond. But from our experience, not just from this project, with other projects, you have to have everybody's buy-in. You have to have the district attorney's office, the judges, the case managers, the county staff, the clerks, and so on and so forth, so that everyone is on the same page. And you have to have some sort of somebody who's a champion within the county who could, push for this and lead this.
Terrence, do you have anything to add, or should we move on to the next question?
No, I think buy-in from the stakeholders it's kind of obvious. I think that what they really like to hear is personal stories of life change. We had one of our participants who's a graduate go to the county commissioners meeting a couple weeks ago. They were floored. They were like amazed at where she's come from, where she's headed, her ability to just articulate herself, the life change and the family feeling. And we encourage all of our graduates, please come back to things. It's so good to hear, things going on in your world. So I think the stakeholders, such as like the prosecutors and things like that, they are 100% in. Sean Dick, who's a district attorney here, he was a former defense attorney, so he knows both sides of this. Our judge, she was a former prosecutor. Our current prosecutor that works on our team is he's super hard on people, but super soft at the same time. Like, he sees the humanity. We had a hearing yesterday, and we had a guy, I told you about one of them, that got kicked out of a one sober house because he used Delta 8, and he was after curfew, but he's working full time. He's way off. He's day and night doing a lot better. His attitude is amazing. The letter I just forwarded to George about what he said yesterday in court was phenomenal, to thank the place that where he was able to get treatment and get sober for 90 days. And so I think that the buy-in from them was amazing. But we wanted to have a consequence to some degree for him having that glitch. And who was the one that stepped up and said, whoa, we need to hold on that. Was the prosecutor. So the prosecutor was like, he's got a lot on his plate. He's right on the edge. He's got a lot of things going for him that are awesome. So we're an accountability team, but along with that accountability is so much support that we put the support first, and the accountability is right next to it, but it's not first. We lead with support. And so we talk about all the positives before we talk about how we can work on things. And we not only tell them what they need to work on, but we ask them, how can we help you? And so I think that is what is the accountability with our stakeholders, is they see the participants buying in because we invest in them. So we have to invest in them first. They don't trust us. We're just another, governmental system as far as they're concerned. So we actually earn their trust first, because they've been burned their whole life, and we haven't. And we have more to give. Now, we do kind of pressure them, and we work on them, and it's not easy, but it's okay to be firm but loving.
Thank you. So I know we're 1 minute shy of 11 o'clock our mountain time. So I think we'll, in the sake of time and just being respectful of everyone else's calendars, we will move on to our announcements. And I do know we have a couple of questions that weren't answered, but we have these documented, and we'll make sure to get these to George and the team, and we can make sure that we answer these and get back in touch with you. And then, of course, thank you to George and Terrence for joining today, for their thoughtful presentation and their thoughtful responses to all the questions that came in. I really appreciate that. So we do offer
Thanks so
certificates of completion to everyone that joins today. If that's something that you're interested in, as soon as the Zoom webinar is over, you will be prompted to complete just a quick survey of your experience from today, and then you'll be able to indicate if you'd like a certificate. And if you indicate that you want one, we will make sure to get that to you in a timely manner. And then this is an ongoing series. So we have our next Research in Progress webinar on October 27th, and that is our team at the University of Connecticut on transit and treatment. And then on November 10th, we have our team at the LA County Department of Health presenting on closing the gaps in health and social services for low-income pregnant women. And we will have this team from Texas A&M back probably in a year's time to present on their progress, and make sure that you stay tuned with all of our webinars. And if you'd like to join to see how they're progressing next year, we'd love to have you. And then, of course, we want to give acknowledgement to Robert Wood Johnson Foundation for their funding of our Systems for Action program. So that brings us to the end of our presentation today. I really thank everyone who joined and thank the team for presenting, and I hope everyone has a wonderful rest of their day.
Thank you.
Bye.